Are you a new parent and worried about taking care of your baby's umbilical cord? Well, you're certainly not alone. Many find the prospect daunting. The umbilical cord is a vital lifeline once, but post-birth, it requires special attention. It's that very attention that ensures your little one stays healthy and free from infection. While it may seem like a big responsibility, it's a common concern, and you're in good company. No need to fret. We are here to walk you through the process step by step. First, it's essential to understand what the umbilical cord is and its role. The umbilical cord is a lifeline between the mother and the baby during pregnancy. It is a conduit for oxygen and nutrients from the mother to the baby, and it also carries waste away from the baby. It's like a superhighway for everything the baby needs to grow and develop in the womb. Now, what happens to the umbilical cord after birth? Once a baby is born, the umbilical cord is no longer needed. It's clamped and cut, leaving a small stump on the baby's belly. This stump will dry up and fall off on its own, usually within 1 to 3 weeks after birth. So, the umbilical cord is not just an insignificant piece of the pregnancy puzzle. It plays a crucial role in a baby's development and life. Now that we understand the umbilical cord's role, let's move on to how to care for it. Caring for your baby's umbilical cord is simpler than you might think. While it may seem intimidating at first, once you understand the process, it becomes just another part of your routine. First and foremost, let's talk about keeping the umbilical cord clean. Normally, it doesn't need much cleaning. However, if it becomes dirty or sticky, you can clean it with a damp washcloth. Use plain water and be gentle. Avoid using alcohol or any other antiseptics unless specifically advised by your healthcare provider. Next, it's important to keep the cord dry. This helps it to heal faster. After a bath, make sure to pat it dry gently. Also, fold down the top of the diaper to prevent it from covering the cord. This helps air to circulate and dry the cord naturally. Now, you might be wondering about dressing your baby. Choose loose and comfortable clothing for your baby that won't rub against the cord. This will prevent any unnecessary discomfort and also allow the cord to dry out more easily. Another key aspect of umbilical cord care is to ensure that it remains unobstructed. Avoid tugging or pulling on the cord. Don't worry if it wiggles when your baby moves. That's normal and won't harm the cord or your baby. Hand hygiene is absolutely vital when handling your baby, and this is no exception when caring for the umbilical cord. Always wash your hands thoroughly before handling the cord to prevent any potential infection. Lastly, remember that the umbilical cord will fall off naturally within 1 to 3 weeks after birth. There's no need to rush this process. If you notice any signs of infection such as redness, swelling, or a foul smell, don't hesitate to contact your healthcare provider. So, to sum up, caring for the umbilical cord involves keeping it clean, dry, and unobstructed. Don't forget about hand hygiene and avoid tugging on the cord. Remember, it's crucial to keep the area clean and dry until it falls off on its own. You're doing a great job, and this is just another step in the wonderful journey of parenthood. You may have some questions or concerns about your baby's umbilical cord. That's perfectly normal. One common worry is if the cord area looks red or swollen. Some redness around the base is okay, But if it's spreading or the belly button is swollen, it's time to call your pediatrician. Spotting a little blood? Don't panic. A few drops are not unusual as the cord heals and falls off. Now, let's dive into some handy tips. During diaper changes, fold the diaper down so it sits below the cord. This keeps it dry and exposed to air, speeding up the healing process. And about baths, sponge baths are your best bet until the cord falls off. Remember, every baby is unique, and so is their healing process. So, patience is key. Always consult with a medical professional if you're unsure. Armed with these tips, you'll be a pro at umbilical cord care in no time. So, let's quickly recap what we've learned about umbilical cord care. We started by understanding the umbilical cord and its importance. We then moved on to how to care for it, emphasizing cleanliness and dryness. We also addressed some common concerns you may have and provided tips to keep in mind. This journey may seem daunting, but with a little knowledge and a lot of love, it's all manageable. Remember, when in doubt, don't hesitate to consult with your baby's healthcare provider. And congratulations on your new bundle of joy.